You'll learn how to use silicone tape to help with your healing. These recommendations are from Dr. Gregory Randolph at Massachusetts Eye and Ear Institute. First, collect your items. Wash your hands before you start. Or use hand sanitizer. Use the measuring tape to get the wound size. The measurement will tell you how long the tape needs to be. Then measure the length of the tape and cut it to the size of the wound. This roll is 1.6 inches wide, or about 1.5 inches wide. That is wide enough to cut in half. Each half will cover the wound. Your roll will last twice as long. Peel off the backing. Then, apply it to the wound. Press on each end, not on the wound itself. The pictures that follow show the healing when using the silicone tape. The patient changed the tape every 2 days. Good luck on your road to recovery.